Today's rounds, which is a partnership between Child Health Evaluative Sciences and the Edwin S.H. Leong Center for Healthy Children. Our speaker today is Lisa Wolff, and it's really a privilege and an honor to have her join us today. Lisa Wolff is the Director of Policy and Research at UNICEF Canada, an organization many of you are familiar with, which has a mission to advance the rights of children in Canada and elsewhere in order to develop their fullest potential, consistent with international human rights standards. A lot of the work that Lisa does involves collaboration with governments, non-governmental organizations, civil society, researchers, and private sector partners to advocate for and with children and youth. She is a recipient of the Queen Elizabeth II Diamond Jubilee Medal from the Governor General of Canada in 2012. And I think what she will speak about today will resonate with many of us as researchers and clinicians in the Leong Center and in CHES. So without further ado, welcome Lisa to CHES Rounds.
Well, thank you very much, Ayel, and thank you everyone for sharing some of your valuable time with me today. I'm joining you from the traditional territory of the Wendat, the Haudenosaunee, and the Anishinaabe peoples in the jurisdiction of the Williams Treaty, which is just north of Toronto. And I'm going to give you an overview, a big picture sense of the work that UNICEF Canada does in Canada for and with Canada's children. And I will zero in on a few aspects of the work that I think align most closely with your interests around research and data. And just a little bit about UNICEF before we go further. The United Nations Children's Fund is the world's farthest reaching humanitarian organization, and we are present in 190 countries and territories, so virtually everywhere, including Canada. And everywhere we share the same mission, which is to secure the universal human rights of children and advance their well-being in so doing. And our mission for children is universal because those human rights are universal. So we're guided by the 1989 Convention on the Rights of the Child, which, as you might know, is a commitment that Canada and almost every other nation have made to assure to every child their right to a childhood, to play, to healthy food, to health care, to enjoy their culture, to protection from harm, to have their best interests considered a priority in the decisions that affect them, and to have a say in those decisions. And in low and middle income countries, UNICEF has a somewhat different role. We enter into cooperation agreements with governments and transfer resources to build the systems and public services that children need to secure their rights. So we build education systems and health systems, child protection and justice systems, even data and governance systems. In rich countries, we are not mandated by the UN General Assembly to provide funding for governments to do their business for children, nor do we provide services. And the premise is that our rich countries have the resources that we need to do what we need to do for children. What is sometimes insufficient is the political will to give children due priority. And that's where advocacy comes in. So our mission in rich countries is centered on advocating to give children a say and a higher priority in the way that governments allocate budgets and create public policies. And so evidence and research and data are very much part of powering the advocacy that we do. Children's universal human rights are really interesting to work with, and we work differently because we work with rights than some other organizations who work for children. The first thing that is important to know or recall is that rights are actually entitlements that we have promised to give children. They're not just nice to haves when budgets permit or when political interest allows, but actual entitlements that we are required to deliver. And children have distinct rights because they are in a distinct stage of human development, where, as you know, greater sensitivity to harmful exposures or deprivations really can have a greater effect and can last a lifetime. But also, when we are making investments in these early years, they can have really powerful impacts on development and the future. Children under 18 also have a distinct legal status because their rights are somewhat different than adults. And so there are limitations placed on the say that they can have about their own bodies and treatment, about decisions affecting them often. And so they can be vulnerable when those decisions are not well thought out, and they can be exploited. So children are at a distinct stage with rights that are designed to protect that stage. And what we also reflect on when we're advocating for children, of course, is that they don't vote. And so what we're trying to do is make space in government among the competing interests that governments have to actually give children, again, a higher priority and more of the budgets that governments are working with. UNICEF is articulated in the convention as an organization with the authority to steward these rights. You know, we don't have the duty to deliver these rights, that's government's duty, but we are named in the convention as an authority to promote children's rights. And so because of the wide inequities that children experience in the enjoyment of their rights, much of our work, as you're going to see, is focused on closing gaps between children along different equity fault lines, often because they're Indigenous or racialized, because they have different genders or gender identities, or lack of citizenship status or lower socioeconomic status. But Canada's ranking in overall child and youth well-being, according to our UNICEF report cards, also reminds us that the challenges that children are facing in this rich country are not confined to the most marginalized. We have some very widespread challenges in terms of children's health and well-being that affect a lot of kids. So we look at the big picture and are recognizing that as Canada's wealth has been steadily rising, Canada's rankings in UNICEF report cards have been falling. And we wonder, where are the dividends for children of Canada's rising wealth? So our advocacy effort is focused on addressing this challenge. And we do this in two key ways. To secure children's rights, you have to work on both sides of an equation. One is supporting the duty bearers, which are governments at all levels, either through technical assistance or persuading them through advocacy to equitably secure children's rights with legislation, with good public policy, with investments, even with specialized governance mechanisms like having independent advocacy offices for children. And on the other side of the equation, to actually work with the rights holders, with children and youth, so that they are able to know and exercise and advocate for their rights. So these are two ways that we work to achieve our mission. And in doing this, we are pursuing three key advocacy outcomes for children and youth in Canada. Child-sensitive governance, so that governments in Canada are accountable for children and their rights. Family-friendly policies, so that Canada has comprehensive social protection policies for children and youth, and supporting the capacity of child and youth advocates so that they are heard on decisions that affect them and can participate in advocacy to secure their rights. There is a role for research and evidence and data in all of these areas, and I'm just going to give you some examples of what we're working on in these areas, and then introduce you to some of our data and evidence tools that we've developed to help us do this and help others engage in advocacy for children. So child-sensitive governance is an important focus of our work. Governance is a way that decision makers can make children visible, again, among many different competing interests, among the non-voting population that tends to have less ability to persuade governments to pay attention to their interests. So it's a corrective mechanism. And it helps to secure children's rights and advance equity. So these are some problem statements that we base our work for child-sensitive governance on. And the kinds of mechanisms that we are pursuing as UNICEF Canada include embedding in all jurisdictions in Canada a statutory independent advocacy office for children and youth. There are still some subnational governments, as well as our federal government, that lacks a child-focused accountability mechanism like this. We're advocating that all jurisdictions undertake child rights impact assessment among the different policy lenses that they choose, and that new laws and policies incorporate and protect children's rights, because securing children's rights in law is the most powerful way that we can actually protect and advance those rights. Here is an example of how we are working on child-sensitive governance. I mentioned child impact assessments are a focus for us. And you might have heard of health impact assessments that some jurisdictions undertake, or gender-based assessment, which is a common policy lens across many different governments in Canada. And governments choose policy lenses because they want to pay attention to certain populations. And really, the choice of these lenses signals our priorities as a society. And very few governments in Canada are using children, or having a lens on children. UNICEF Canada began working with the government of New Brunswick a number of years ago, which was the first government in Canada to adopt child rights impact assessment as a whole of government policy lens. Since then, we have been working with the Yukon government, with PEI, and with the federal government in the Department of Justice, which is now on a path to developing child rights impact assessment. But at the same time, elected officials, parliamentarians, and members of legislatures at the provincial territorial level have a duty for due diligence when it comes to children and youth. And if they start asking governments who come as witnesses, or looking at bills that they're obligated to scrutinize from a perspective of how they might impact children, then they're also able to play their part in due diligence and good governance for children. So I'm just going to introduce you, if I can open this link in this presentation, I hope it works, to a new tool that we have developed working with policy advisors in Parliament in Canada. It is the Child Policy Lens. And in the simplest terms, it's sort of a cue card for parliamentarians to be thinking about and asking about the impacts on children when they're looking at, again, bills, or engaged with witnesses, or studying an issue. And we have a series of questions by which they can engage to understand potential impacts on children, looking at what rights might be affected by a decision, positively or negatively. How might different groups of children be affected by a decision? What are the distributional impacts based on different equity lines? Have children been consulted on a decision that affects them? Does the decision allow for children to actually have a say, as in divorce law, for instance, where there have been recent improvements? Are there arbitrary age limitations or statutory discrimination? And so on. So this is a tool that's in a prototyping stage that we've been working on, and are gradually rolling it out with parliamentarians. When it comes to family-friendly policies, again, there are a lot of case arguments to make that we don't have yet in Canada a robust social protection system for children and their families. And so we are advocating that the trifecta of family-friendly policies are strengthened and more inclusive in this country. And rich countries at the top of the UNICEF rankings in our report cards tend to get better outcomes for children because they have very powerful family-friendly policies that cover the children in their country well. What are those policies? They are income benefits for children to lift them above the poverty line, universal access to quality childcare, and access to parental leave. And in 2020, when we measured these policies and looked at how Canada's children ranked relative to other rich countries, we found that the biggest spending gap deficit that Canada had compared to the top 10 countries in our rankings amounted to about $30 billion. And it was really in these three family-friendly policy areas. Since then, we have certainly seen greater commitments. Now we have a federal partner for the advancement of universal access to childcare. But we still have a child poverty problem in this country, despite some improvements in the Canada Child Benefit, for instance. And we have a lot of children who are left out of protected time in the first months of life, including through parental leave. We also have kids who are food insecure due to, in part, child poverty. So we're pursuing some policy solutions that can include more children in these policies, and that could have a salutary impact on many different areas of their well-being. And these are where we have some research needs that are unmet. We don't have research capacity in UNICEF Canada. We partner with research institutions to get the evidence we need to make the case for our policy priorities and even to choose them in the first place. So for instance, we don't know right now how much the improvement of access to childcare and affordable childcare is going to have an impact on the child poverty level in Canada. Is it a child poverty solution? Maybe, we don't know. But it's important to know, because then we will have a better understanding of how much the income benefit programs need to keep working to bring more children above the poverty line. The expansion of parental leave. Right now, about a third of infants are left out of parental leave. There are so many parents, mothers who are ineligible for the EI-based parental leave program. What would happen if that were to become a universal caregiving approach rather than an EI-based approach? What kinds of health impacts would that have on children and, frankly, mothers and families more widely? So those are some key research areas that are still, I guess, have some unmet needs that we would like to pursue as we go forward in advocacy. And then the third area is empowering children and youth as advocates. So we have a youth advocacy program where young people teach each other advocacy, because many of them are very well skilled in advocacy, and learn more skills and learn about their human rights, their civil and political rights to advocate. We have an annual youth activism summit where young people engage with decision makers, and we have a U-Report program that I'll tell you a little bit more about in a moment. But all of these initiatives with children and youth to become part of the advocacy process are actually developed with children and youth. We listen to the young people that we work with to tell us what they need from us, how they want to participate with UNICEF, in what advocacy priorities, and we design accordingly. And like our policy initiatives, which are designed to close equity gaps, our youth participation programs have an overrepresentation of youth who are farthest from opportunity in this country. We have four key strategies by which we pursue those three objectives that I've just reviewed. One of them is evidence and data. So I'm going to focus on that because I think that's got the greatest alignment with the areas of interest that you work on. When it comes to our strategy around evidence and data, I've listed 7 key ways that we work with evidence and data on the slide, but I'm going to share with you some particular examples with the Canadian Index of Child and Youth Wellbeing and U-Report Canada. But I think what it's important to know is that for us, generating evidence, compiling data, communicating that is part of generating the kinds of policy decisions that we want. It produces the evidence for those decisions. It helps us understand what policies, what kinds of impacts that they're having on children and youth. We also empower, again, other advocates, other organizations working with children and youth to have a deeper understanding of the lives of children and youth through data and through the analysis that we bring to data. So we've got, again, a number of different tools that we're using, and I'll introduce you to UReport first. UReport Canada. What is it? UReport Canada is a polling platform that we use to understand how young people are experiencing their lives, experiencing unfolding events like the pandemic, and how different policy decisions are affecting them. This is open to all youth in Canada between ages 13 and 24. So even though the focus of our policy work tends to be under 18, which are the convention rights holders, some of our youth engagement programs go a little wider for different reasons, at least demographically. And UReport offers young people who subscribe to it as UReporters bi-weekly digital polls, again, to gauge different ways that they're experiencing their life. And then we amplify the results. We use it to shape our own policy advocacy, to comment on, again, unfolding events or different policy decisions. It's a quick and easy way to get a real-time pulse of how young people are feeling or what they're thinking. And at this time, we have more than 1,300 UReporters and counting in Canada. UReport was invented by a Canadian working in Ghana. It's currently active through UNICEF in more than 90 countries now, and globally there are 22 million UReporters. So we're part of a big family. And this is a youth advocacy program where we have very few barriers to entry. So any young person in that age range in Canada can join. So currently we do have representation from every province and territory. We operate in English and French, and we have a growth through inclusion strategy. So in different ways, we actually seek out young people who are diverse and far from opportunity. So we have, compared to the Canadian population, we do have an overrepresentation of young people who are Indigenous, who are gender diverse, who are in low socioeconomic status as they self-identify. And UReport is an appealing place for them to have a voice. Some of them tell us, we've never been asked what we thought about things before. But it's a place where they feel heard, and we don't ask UReporters anything unless we can make use of the information in some way. We don't just ask them questions for posterity. Again, we use it in advocacy as UNICEF Canada or our UReport steering committee partners, which are Canada's largest youth organizations, like Kids Help Phone and the Y, Boys and Girls Clubs. We collaborate to develop polls. And because somebody needs that information to make life better for and with young people. So just an example of a couple of polls that we have done through COVID, because UReport is certainly fit for purpose, during a pandemic when we could only access young people digitally for quite some time. And we needed a real-time sense of how this evolving situation was affecting them and what their needs were. So here's an example of a question where we asked if young people felt like they could benefit from mental health support at an early stage in the pandemic. And the overwhelming response was yes, 84% felt in need of mental health support early in the pandemic, experiencing, as it would be well known to you now, a great deal of duress in that period of uncertainty. But when we asked how many would feel comfortable seeking mental health support if they needed it, only half said they would feel comfortable. So immediately there's a gap there in terms of the kinds of services we're offering. And we learned all sorts of interesting things about willingness to use, something like Kids Help Phone as opposed to other ways to support their mental health. Just a brief example there. UReport Canada is really somewhere in between a very large focus group and a small survey at this time. It has some interesting properties from both, but also some unique properties. And it's something to think about, as you're doing your research, if you felt that this would be an interesting complement We are open to collaborating on polls, and we have done that with different organizations in Canada, not just the steering group. And we have U-Report ambassadors, so young people who can come and present on poll results as well, to organizations that are engaged. And we can amplify poll results at conferences and webinars and so on, just to bring in some youth voice and youth perspective to the issues that are being covered there. So if anyone's interested in potential to collaborate on a U-Report poll for the work you're doing, you can follow up with me. And I'm going to review a few highlights from our Canadian Index of Child and Youth Wellbeing before we open up for discussion. And this is, again, another example from the body of our evidence and data strategies. It is a framework that we have developed to monitor and, more importantly, communicate the state of children and youth under age 18 in Canada. So I'm going to highlight a few features of the Canadian Index of Child and Youth Wellbeing. I want to reflect first that UNICEF has called on governments, and this applies to governments at all levels everywhere, to measure and monitor the state of their children. And this is part of Canada's obligation in ratifying the Convention on the Rights of the Child. It's considered an accountability mechanism to be able to track progress as a country, not just by wealth, not just by general population status, but how our children and youth are doing. And so the index is a tool to help facilitate that. It's an independent social accountability effort led by UNICEF Canada. And it took us 3 years to construct this index. We had extensive engagement and research across Canada and internationally, including with young people. And I think the result is a very holistic and relevant view of child and youth well-being along the dimensions of life that are important to them, as well as to people working for and with kids in Canada. So you'll see dimensions of life that we don't often or always pay as much attention to when we're monitoring the state of kids. We get a lot of attention focused on their health, especially their physical health, or how they're doing in school. Those things matter a lot to adults. But what about children's right to play, which is sort of the quintessential part of being a child? Their right to participate in society, in their families, at school, in decisions affecting them. Whether they are materially secure, how well they're connected to a healthy environment, and ultimately if they are feeling happy and good about their lives. So a broad perspective that is quite based on children's rights, but goes beyond into well-being. And this instrument looks different than some other dashboards that are in effect to measure and monitor the state of children. It can be difficult to make space for children and youth in indicator frameworks that different governments use. And we have to keep reminding them that when they're developing their own accountability frameworks, that children really do need different things than the general population. As you all know, it's a distinct state of development, and they have entitlements to certain things in childhood, like immunization and schooling and play, that really matter at that time. And they think different things are important to their well-being than adults sometimes do. We know that relationship quality really matters at this stage of life, as well as, again, how well they're doing at school or if they're engaging in risky health behaviors. And we know that unless we're asking kids about some of these things and how they're experiencing these things, we can over or underestimate how they're experiencing them, because adults often, don't quite know when we guess. And so for many reasons, a focus on children and youth is key, and an instrument to communicate their well-being was important. Because we always get asked this, how did you decide what you were going to measure? Well-being means different things to different people, which it certainly does. But we began with discovery roundtables across Canada and asked hundreds and hundreds of people, including young people, what child and youth well-being meant to them. And we came up with this sort of collective vision that we worked to measure and choose indicators and then find the data, if it was available, to measure these things. There are a lot of commonalities about what people would expect for good childhoods in this country. Some things are tougher to measure than others. So we have 125 indicators, which in some respects is a lot, and in some ways it's too little to understand how our kids are doing. 60% of the indicators are actually based on self-reports by young people. So we wanted the majority of indicators to be from the experience and voice of young people. The indicators, as far as possible, measure the status of children and youth. So there are things that you can observe in, or things that are reported by young people. And the data that populates the index comes mainly from large statistical population level surveys in Canada, run by government or quasi-governmental. Some of the indicators we developed were new ways to put data together to measure certain concepts, and we do disaggregate where possible. And our intent is to put out the index every 3 to 4 years. The first was launched in 2019, so we're starting the next iteration this fall. And the index helps answer questions like this. Why are so many kids unhappy in this country? How well is Canada fulfilling their basic needs? And are we paying attention to the right things? So I'm going to end with just a couple of examples of what the 2019 index told us, that were a bit provocative. So in the domain of, are we happy? How are our kids happy? It was surprising to many that so many kids are actually not very happy at a time of life when we would expect them to be happiest and most carefree. Only just about half rate their life satisfaction high, and about a third have felt sad or hopeless for at least 2 weeks, which, you know, approaches the level of clinical symptoms for depression. We have a happiness deficit in childhood at this time in Canada. And when we looked at material security, you know, we looked at the official, fairly new official way that the federal government measures poverty, which is the market basket measure. And that, using that indicator, you know, about 9% of children and youth in this country lived in poverty. But when we use the gold standard to measure poverty, which is the low income measure across rich countries, the rate is actually double that. It's 20%. And this is really a measure of poverty of opportunity. These are children in households that can't afford the kinds of things that young people need to feel like they can participate normally in society, like other young people do around them. 20%. It's also more aligned to indicators like food insecurity, where it's, again, closer to 1 in 5 children than 1 in 10. So it's important to look at material security in different ways, but also from the perspective of young people. And then finally, in the area of learning, you know, Canada does really well in international surveys of learning achievement, certainly by the high school years. We have a generally very equitable set of education systems in this country, and children tend to do well compared to kids in other wealthy countries. But when you ask young people about their school experiences, it's you know, pretty astonishing that fewer than half actually feel good about being at school and the school experience, and a quarter feel like they have more schoolwork than they can handle. So we're putting a lot of pressure on our children to succeed at school. You know, so if we're only paying attention to measures like, are they getting good grades, again, that a lot of adults and policymakers care about, but we're not asking kids what it's like to do that. You know, we're missing out on areas of life, including how their mental health is being affected, that really matter. So this is the kind of information the index allows, and it's having an influence on how different jurisdictions are changing the way they measure child and youth well-being, changing the way they measure the impacts of their policies and services, how they set goals. So a pretty powerful tool, because it's not just a data tool, it's a communication tool. And because we're advocates at UNICEF Canada. So we just released our latest report card last week on children in rich countries. And you can find it at the website on the slide. And if you follow us on Twitter at UNICEF Canada, we invite you to register for an upcoming conference that we're co-hosting with McGill called Disrupted Lives. And it's examining child and youth policies that have been implemented in Canada throughout the pandemic, and what we know now about how it's affecting kids, what we don't know yet, and how we can better center young people in decision-making going forward. So you can see at our Twitter account at UNICEF Canada how to register for that. So thanks very much. That brings me to the end of my presentation, and I would love to have a discussion about questions you have or opportunities you see for us. And thank you so much.
Lisa, thank you. That was fantastic. And I'm looking at the latest version of the report card, and Canada moved all the way up from 30 to 28. Although I think there's more nations now than there were on the first, on the last iteration. It's gone from 38 to 39, but still a fairly mediocre, I think, international ranking in OECD countries. I'm going to just begin by asking a question while other people are thinking of theirs and their comments. Can you comment a little bit around whether the appropriate unit of analysis for a place like Canada is federal or provincial in report cards? We obviously have no federal Ministry of Education. Most of health is decentralized. A lot of the aspects of child well-being are usually at provincial or even municipal levels. So just wondering about interjurisdictional differences within Canada on some of these metrics and whether we should be reporting them.
So when it comes to the UNICEF report cards, which compare Canada with other rich countries, we're using a more limited data set because we're only able to use what you can measure comparably between countries. So, what do rich country governments agree to measure in the same way that's meaningful to follow? Our index allows us to focus on data that's available in Canada, so it takes us into more places than the UNICEF report card series. But I mean, really the answer is both. Obviously we have shared responsibilities in Canada and shared duties for children's rights across different levels of government, and even community levels can have a fair impact depending on the aspect of life you're measuring. But the biggest gaps Canada has had compared to other rich countries have really been in the social policies affecting kids. We underinvest by much more in the social protection policies. And that's why it's a focus for UNICEF Canada. But those are all really federally, again, they're shared, but federal government has a big role to play due to its capacity to tax and to share revenue. So in childcare, now we've seen how that can work. When you have a federal partner with big tax powers who can invest billions in childcare, as well as provinces and territories grinding away at improving access, it can be really powerful. Now, all of a sudden, we get to a world where we can actually have a universal, good quality public program like the top performing countries do elsewhere. But when it comes to parental leave and child poverty reduction, those are largely federal policies where, again, we're still excluding so many children compared to other countries. And those policies are powerful in their impacts on child and youth health and well-being. So it's both.
Thanks, Lisa. I want to open up the floor to any questions or comments. Please feel free to use your raise hand function. Stanley Zlotkin, I see your hand first.
There you go. Thank you. Eyal, and thank you, Lisa. Nice to see you. This may be a tough question for you, but given the fact that you've identified three important areas: child-sensitive governance, family-friendly policies, and child and youth advocacy, and given the fact that your new report has just come out and we haven't really changed our position in the world very much, why is it that UNICEF's advocacy efforts have been not perhaps very successful in the past? And perhaps adding to that is, what can we do to help you be more successful? The one thing the UNICEF has is the ear of those who can make decisions both provincially and federally. And individually, each of us individually may not have that same ear. So again, I would say that if UNICEF has been successful in Canada, we might have done a better job in those three areas. But why have you not been more successful? And what can we do to help with UNICEF's, help UNICEF become more successful in its advocacy role in Canada?
Well, as advocates, we tend to focus our communications on the unfinished business. So if we are not telling Canadians enough or telling you enough about the fact that actually Canada has made some really significant progress in the areas that we've been focusing on, then maybe that's a fault we have. But in the child sensitive governance mechanisms, we're gaining momentum. We finally have a federal partner who's committed in the Department of Justice to develop child rights impact assessment. We have 3 provincial territorial governments now, not just the one that started out about 5 years ago. We used New Brunswick as sort of a learning lab to demonstrate that this can happen, governments can do this, and how they can do it. And it does take time to convince governments to do big things, to commit the time and resources to do something like that. But I'm really encouraged by that progress. When it comes to the family-friendly policies, since over the last 3 report cards we have had the federal government commit to a poverty reduction strategy and actually agree on a federal official poverty line, a measure that they will be held accountable for that includes child poverty. Is it perfect? No. I mean, we prefer that the LIM measure be used rather than the market basket measure. But they've also improved the Canada Child Benefit. So we actually have been making progress to lower child poverty. It's just not sufficient yet. The government hasn't checked the box on that. They're not done with that. It's all about making these things more inclusive now that we're on a pathway for improvement. And then we've got the childcare commitment. So we can't say there hasn't been progress or a lack of success. And we don't do this alone. We work with coalitions like Campaign 2000. The latest report card is focused on children's environments. So it's measuring different things than the last report card that we published in 2020, just before the pandemic. So we can't compare the current ranking with that, but we are looking forward to seeing in the next report card in about 18 months, whether Canada's efforts in those family-friendly policies to date have been enough to actually see a shift in the rankings. They were in the UK, the UK introduced improved policies like this before we did, and it was a measurable result in the UNICEF rankings. So that's what I'm going to be looking for, is the next report card.
Next question is from Dennis Daneman.
Hi, Lisa. It looks as if what's happened over the last 10 or 15 years is that what UNICEF is doing is become more and more sophisticated, but it's still finding the same thing, that Canada is split in the middle and sort of oozing downwards. There are certain things that in advocacy where you're taking the right tack, I think, but is it room for more specificity, such as supporting a child health commissioner, supporting minimum basic incomes, those sorts of steps, at a time when the top 1% are getting richer and richer and the bottom 50% are getting poorer and poorer?
Well, income benefits for children are like a guaranteed minimum income for families with children. So that has been our focus, is something that's achievable and within our remit. Not to say that minimum basic income might not, but again, there have been advancements, it's just not enough. And that's true of all of these policies. Childcare remains to be seen. That's got the most universal ambit right now. When it comes to child-sensitive governance, having a federal accountability mechanism, whether it's a commission or commissioner, is still on the table for us. But frankly, there has not been agreement among Indigenous groups who are concerned with children and youth for what that should look like. And we walk a reconciliation path. We don't want to push ahead without the time to really work through some of these issues at the federal level, at least in that case. So, in the meantime, we've been working at provincial territorial level too. And we were instrumental in having PEI appoint its first child and youth advocate just a couple of years ago. In fact, he used to be my colleague at UNICEF Canada. He's the first child and youth advocate there. So, we always have that big picture in mind, but we flow to where governments are also ready to make a difference. And there's only 4 of us at UNICEF Canada, so doing this work. So somebody asked, what do you need? Where do you need help? Well, we need help in doing some of the research that I outlined, to make our case. The voices of the health community like this are incredibly influential and powerful, and ways you can keep working through your organizations, including Children's Healthcare Canada, in advocacy. And Children's Healthcare Canada is such an important partner for us at UNICEF Canada. That's going to be key to keeping these issues front and center and keeping the incremental progress going that we're enjoying to this date.
Can I add one comment to this? Child protection policies vary in different countries and vary in different populations within the countries. For example, children in First Nations groups tend to be 17 times more likely to be in child protection systems than children who are not First Nation. Does UNICEF have a stand or any information on that globally?
Well, the situation is somewhat different in countries that have Indigenous populations. I mean, in low and middle income countries, again, where UNICEF has cooperation agreements, we're helping build specific education systems for Indigenous children, for instance. In other rich countries, the Indigenous populations have a very different makeup than they do in Canada, whether it's Australia or New Zealand or Greenland and Denmark. But we work with different Indigenous partners here in Canada as allies, not to get in the way of the advocacy that they're seeking, but to support it, as we did with Jordan's Principle when we worked with several universities and the Canadian Pediatric Society and some Indigenous organizations to study the implementation of Jordan's Principle, what was working, not working, and largely not working, and how it could work better. So through the tribunal, Canadian Human Rights Tribunal process, and through government openness to making changes, there's been some improvements in Jordan's Principle. But we played a role in documenting what was going wrong, and did that because that's what we were invited to do by the Indigenous organizations who were working on that.
Thank you.
Catherine Birkin.
Hi, Lisa. Thank you so much for your talk today and for all of you and your organization's work. I'm just going to go back to the issues around basic needs and poverty, and what we see as clinicians, in caring for individual patients or families that are living in severe poverty and just really unable to bring themselves out of poverty. You noted that there have been some important impacts of the child tax benefits, but there's more work to do. So just wondering, as clinicians, as researchers, like how can we, or what is needed? Do we need to test unconditional cash transfers? Do we need to better understand feasibility of those sort of processes? How can we be effective in supporting, that goal of reducing poverty in children? Or eliminating it, I guess.
Yeah, right. Well, I mean, there's one of the most powerful things is simply to increase the power of the Canada Child Benefit at the low end of the income spectrum to lift more children above, at least 50% of median income as a start. There's some administrative fixes to make it more inclusive, including to non-status children who are in this country. But I think, research on unconditional cash transfers, which is a really big effort now in, frankly, low and middle income countries too. And I think Canada's, like most rich countries, farther along the policy spectrum and recognizing that. How much is it, can tip the balance, and for who? If it's more targeted, prenatally, mothers tend not to have access to income benefits. But what difference would that make to health? And we have some, conservative leadership candidates proposing different models to keep building on the income benefits that families have for children. Which model would actually be more compelling? So there's a number of different questions that would benefit from research. But I think even just telling the story as health practitioners and clinicians can about how poverty is manifesting in children and children's health, telling those personal stories can be helpful.
Thank you.
Are there any other questions? Maybe I'll just ask one while people are thinking of other ones. Lisa is very intrigued by the Your Report platform, and just wondering, what are those next strategic directions for UNICEF on is it expanding the number of youth, more partnership with researchers or end users in utilizing it, because it's a spectacular tool, and a major issue in research in pediatrics is how infrequently we capture youth voices on a whole variety of different issues.
Yeah, one key interest we have is growing the number of U reporters. Frankly, not because we are likely to get very different results than we already do, but because it could make it a more influential tool. If you've got 5,000 young people saying something instead of 1,300, or a subset of that based.
I think, am I hearing?
Deploy information to you reporters. So it's not just asking them for information, but giving them information. So we've deployed chatbots on vaccine misinformation during COVID, for instance. So having young people be able to be peer agents of change with each other is an interesting area for growth.
I'm just looking to see, there's one more hand up. It is Antonia.
Thanks so much, Lisa. I was also just wondering, as Leong Center and, our members and others who are on this call, we're trying to, as Stanley asked, how can we be of greater help? In your long experience with UNICEF Canada, I know you've worked across many coalitions and platforms throughout the year that bring together researchers and governments and other advocacy types of organizations. Do you have any sort of insights in terms of, which kinds of approaches have worked best to be able to help meet research needs? What are some of the, challenges that, you're aware of in bringing that alignment together, and, any kind of examples of where that has been successfully addressed?
Well, in my view, researchers and those particularly working with data have done so much in recent years to reach out to civil society organizations and policy developers and try to make those links so that the work is grounded in a cycle of research to implementation and back. I just want to say that I think that right now, as we've got some really powerful new federal policies emerging, like around childcare, still some big questions about how is that, might that bring down child poverty? We don't know. Or do we need to keep working on the Canada Child Benefit? What about unconditional cash transfers for earlier in, pre-birth, prenatal period? There are a number of questions, I think, centering on where Canada's making these big investments that we still have big questions. And parental leave is another really our area ripe to better understand. What if we included more infants and mothers in parental leave? What kinds of health and broader impacts could that be? And I mentioned those things before, but that's where I think there's some real opportunity right now. And whether it's maybe a policy to practice summit where we can bring together some organizations working on the advocacy and policy development side, and economists and health researchers, and see if we can come up with an agenda for research that can be desperately needed and can be used to move into advocacy and policy making. That might be an interesting thing to do.
I think we have time for one last question. Zilfi.
Well, thank you very much for that very helpful discourse. So my question pertains to your view and thoughts in terms of how one can combine some of UNICEF's global agenda and some of UNICEF's agenda linked to Canada per se. So some of us work on many of the issues across the world with UNICEF. There are many overlaps, whether they relate to inequities, whether they relate to issues, and particularly during COVID, I found it quite challenging at times to limit oneself to issues in only LMIC. So could you say a word or two about what opportunities might there be to work on issues which are more generic, more general, affect children and families all over the world, irrespective of geographies?
Well, it works, I guess, two ways, essentially. UNICEF, like the domestic focused program that I run, has an international programs team that focuses on convincing mainly the federal government to invest more in child-focused programs that UNICEF mounts in cooperation with governments in low and middle income countries. So can we spend more of our ODA on children and youth, and in what areas? That's their focus. There's certainly a policy continuum. Antonia mentioned, no, it was Catherine Burke mentioned cash transfers, unconditional cash transfers being one where UNICEF is learning from the experience in high income countries and really pushing in middle and low income countries to introduce that as part of the social protection policies. But we're trying to import what UNICEF is doing in, for instance, public finance for children, better budget tracking in rich countries of what's spent on children and youth and how, and is it a fair share, and does it have impact? For UNICEF, it's always going back and forth. For COVID policies, we got a lot of our guidance from UNICEF, which was, we have a health team who was heavily advising governments around the world on COVID, working with WHO. So questions like, should children be excluded from recreation and sports teams if they're not vaccinated? Was a key policy question. UNICEF had a position on that, for instance, that we were able to avail ourselves of. So yeah, it's a complex question, and the answer is complex. It goes both ways.
So on that note, on behalf of the Leong Center and Child Health Evaluative Sciences at CHES and the University of Toronto, Lisa, thank you so much for joining us today. It was such a rich discussion about the outstanding work UNICEF is doing to better understand and advocate for the needs and human rights of children and youth in Canada and beyond. So thanks again for everyone who participated today, and wish you all a wonderful day.
Thank you.